Hello friends, my name is Dr. Kedar Patil. I am a bariatric, robotic and advanced laparoscopic surgeon practicing at Precise Clinic in Pune. So in this video we will be seeing and discussing the most commonly asked, frequently asked questions regarding a bariatric surgery. So as you all know, bariatric surgery is also known as weight loss surgery, and metabolic surgery is something that we are doing to treat the diseases associated with obesity like diabetes, hypertension and rest of the diseases. So there are a lot of doubts in minds of patients when they come to us because they have heard it through hear and say about this surgery. So in this video I'd like to simplify things and answer these doubts. The first question that people ask when we advise them bariatric surgery is why surgery and why not just try diet and exercise. Well, let me tell you, there are n number of publications and enough literature available worldwide, scientific literature per se, in which long-term weight loss with diet and exercise is up to 10% of the total body weight. So someone who is 120 kgs, 12 kg weight loss would mean nothing to this patient. This patient requires a bariatric surgery. As against, diet and exercise is good for people who have a BMI less than 30. So diet and exercise definitely is a treatment module, but there are very specific indications where bariatric surgery works well in the long run. Another question people ask about bariatric surgery is why not give medicines instead of surgery? Well, let me tell you, medicines work and cause a 3 to 5% of weight loss in patients who are taking them regularly. At the end of 3 months, if this 3 to 5% weight loss doesn't happen, it is recommended that these patients need to change their medicines or add another medicines. But again, generally what we are seeing is not more than 10% of total body weight is lost with medicines alone. So someone who is taking medicines with the hope that he would lose 30-40 kgs is not going to happen with medicines alone. When is bariatric surgery recommended? Bariatric surgery is recommended when a person's BMI is about 30, when he is having comorbid conditions or diseases such as type 2 diabetes, hypertension, joint pains, breathlessness, sleep apnea, infertility, PCOD, fatty liver. So obesity is never a single problem. There are multiple problems associated with obesity, and anyone who is having a BMI about 30 is eligible and should undergo a bariatric surgery. Well, about 35 bariatric surgery is recommended for all those who don't have any problem, irrespective of the problem. The reason is eventually these people who have a BMI about 35 will definitely have problems, be it either diabetes, hypertension, joint pains, sleep apnea or fatty liver or rest of the problems. So Indian Bariatric Surgical Society has recommended these guidelines that surgery above 30 with diseases and above 35 without diseases is the indication for a bariatric surgery. Well, what would be the side effects after surgery is a common question that people ask. So let me tell you, bariatric surgery is required when the problems are more. So when you compare the side effects versus bariatric surgery, the major side effects are very few. It is 0.1 to 0.3%, which includes situations like bleeding or a staple line leak or a thromboembolism. These are generally problems that are seen in the first 5 to 7 days after surgery. The minor problems happen in about 1 to 3% of the patients. This is worldwide data, which include wound infections, hair loss, nutritional deficiencies or skin laxity. But let me tell you that we have ways and means to prevent these complications and treat these complications. So, this complication rate is as same as anyone undergoing a surgery for an appendix, a gallbladder or hernia surgery or uterus surgery. The reason is when a bariatric surgeon who is trained and his team is well conversant with all the bariatric surgeries and the procedures, when they optimize a patient, another common question that people ask is, what if I regain the weight that I have lost after bariatric surgery? So, let me tell you that 85% of the patients do very well with bariatric surgery. Weight regain is seen about 10 to 15% of patients. Mainly it happens in non-compliant patients. When I say non-compliant, it means that patients who do not follow the instructions that we advise after bariatric surgery with regards to caloric restriction in a diet or regular exercise or change in lifestyle. So, these are the patients who may have a weight regain, but to say large part of the patients, 85 to 90% of the patients do well. They lose weight and they maintain this for more than 10 years duration. Bariatric surgery adds 8 to 10 years of lifespan to a patient's life. This has been seen in the worldwide scientific data. The next question people ask is cost of surgery. Cost of surgery, let me tell you that a good thing that has happened in India is insurance is covering this surgery, because insurance companies have understood the value of this surgery and it prevents repeated hospitalizations to people who have diabetes, hypertension and rest of the diseases associated with obesity. So, IRDAI has made it mandatory after 2019 to cover this surgery in all the new policies, and old policies of course are covered. The central government health scheme has also understood this aspect, and that is why CGHS patients get this surgery free of cost. Some of the government employees, the CSMA patients also get this surgery free of cost. And in Pune, we have the local municipal corporation which cover this surgery. Of course, there are in the bigger corporate hospitals now, there are financial companies who assist patient financially with their terms and conditions. You can check these at these corporate hospitals. For the patients who don't have insurance or neither they are falling into these different categories, the cost of the surgery depends on the type of surgery, the surgical qualifications of the bariatric surgeon, the hospital where this surgery is done, the room category and the type of implants that surgeon is using for the surgery. So, it is always better to meet the surgeon, discuss the patient related problems and then discuss about the cost rather than just calling up and asking, which we commonly see. The next question people ask is how much time is required for bariatric surgery? Well, it depends on the surgery that is being done, the BMI of the patient. Usually it takes about half an hour to 1 hour for a sleeve and 1 to 2 hours for a bypass procedure. But again, it's the body habitus, the BMI, the medical condition of the patient that decides the operative time. The preparation time is about an hour before surgery and about half an hour, 45 minutes after surgery. So, this is the total time that is required for any bariatric surgery. Generally, 2 to 4 days is the time required where the patient needs to be in hospital. Usually we admit a day prior, we operate, and next day or maximum third day the patient is discharged. The patient is made to walk on the same day or next day. He is started on the liquids the next day.